Have you ever heard of a forehead reduction? Some people also call it a hairline advancement. What is that? It's a procedure for people with really large foreheads, and we literally move the hairline forward. Why would you do that? Doesn't a hair transplant accomplish the same thing? What does it look like after it's done? Do you have a scar on your forehead? I'm going to talk about all these questions in this video. My name is Dr. Peter Vila, and I'm a facial plastic surgeon. So to understand why someone might need a forehead reduction, it's important to consider how we look at faces. So I do have another video that talks about that. But basically what we're doing is we divide the face into thirds. And so when you take the top third of the face, that's typically from the brow to the top of the hairline, that should be about equal to the distance to the brow to the bottom of the nose, or the subnasale, that's another third. And then from the bottom of the nose to the chin, the subnasale to the menton. That is basically what we're looking for to compare the thirds of the face. And so if you have somebody with a really large forehead, maybe they were just born that way, maybe if you've worn your hair in a ponytail for most of your life, you can actually get what's called traction alopecia, where you start to lose some of the hair along the hairline because it's all pulled back. For whatever reason you might have it, a lot of people, sometimes that bothers them, and that can make you look a little bit older, a little less feminine, if that's what's going on. Now, women alone don't do this procedure. Sometimes guys do this procedure. So that brings up the question of who can have this procedure. Is it just for women, or can guys do it too? And the answer is guys can do it too. It's mainly for women. Why is that? Because in women, it's not a very feminizing characteristic to have a large forehead. So if you bring the hairline down, that does help quite a bit. The other benefit is that women tend not to have the same pattern of hair loss as men as they age. So in men, it's very common, like myself, you start to get a receding hairline. And so if you have a scar that's normally hidden by hair, but then all of a sudden you lose that hair, now you're just gonna have a line going across the middle of your forehead. So in men, I will only do the procedure in somebody who has no family history of hair loss. If it looks like you have a predisposition towards a male pattern hair loss as you're getting older, I would not recommend doing this procedure. In women, oftentimes you can have hair loss as well, but it's a different pattern. It's more sort of the entirety of the scalp and less in terms of losing the hairline. However, if there is a strong predisposition towards hair loss as a woman, that is something that I would take into account as well and would maybe recommend you not have the procedure. For everyone else, if you have a big forehead and that's something that really bothers you, a forehead reduction or a hairline advancement is something that can be done. So what does that actually look like? How does the technique work? What we do is, if you look at your hairline, it is not a straight line across. The other thing to appreciate is that men and a lot of women tend to have some degree of what we call temporal recessions, where the hair doesn't just come straight down, it actually goes back a little bit and forming this M. Now the M is typically much more often seen in men, but you can have it in women as well. Some women want the hair brought down so that it just comes straight and frames the face. Now you can't bring it down too much, because if you do that, it just looks unnatural. But the big thing to notice is that your hairline is not a straight line across. It's actually a little bit wavy. And so if this were to be a procedure you had done, look at sort of other incisions that the surgeon has done in the past, because if it looks like it's going straight across, that's unnatural. That just is not going to look good. My aesthetic is always to be as natural as possible and to make it as undetectable as possible. So having a little bit of irregularity in the hairline is a good thing. Now, if the issue is out here with the temporal recessions, can you address that with a hairline advancement, or is a hair transplant better for doing the same procedure? A hair transplant is very useful for filling in areas of hair loss. The difference between a hairline advancement and hair transplant, or forehead reduction and hair transplant, is that the forehead reduction, you're going to get the same density of hair, just lower down. With the hair transplant, the hair is never going to be as dense. So it's nice because you don't have the same scar, because the scars are all well hidden from the posterior scalp, where the back of your scalp, where all the hair comes from. But you're never going to get the same density that you're going to get with a forehead reduction, if the goal is simply to advance the hairline. Hair transplant does work well in addition to forehead reduction if you have large temporal recessions. So in somebody like that, maybe a woman with large temporal recessions, the hairline can be brought down, you can slightly reduce the size of the temporal recessions, and then a hair transplant will fill in the rest to get it nice and even and get the density that you're looking for. We can do that in a very natural way as well. The other benefit of a forehead reduction is that the hairs don't change direction. So because we're simply just advancing the hairline, we don't have to worry about the direction of the hair, which is a big concern in hair transplant. But obviously you're going to choose somebody who knows what they're doing if you do get a hair transplant, and that's something that they know to look out for. Now, if you do a forehead reduction, you are going to have a scar because you have to incise along the forehead. When you make that scar, that generally looks like a dark line going all the way across that is going to be hidden by the hair eventually, but in the beginning that it is pretty visible. So I often recommend that when patients have this incision, in the first month or two, you can wear a scarf or headband over the incision so that it looks stylish and it covers the incision as well. So that's something to consider, but you do have a scar going across, and in most people that is going to result in just a thin white line that's just where that incision is, just behind the first couple hairs into the hairline. Like any other surgery, there are risks to a surgical procedure, and so with the forehead reduction, the big concern is what we call shock loss. Shock loss is when you have a decreased blood flow to the scalp so that a large amount of hair falls out, and you might get a big spot of hair where that falls out. That's what's called shock loss. How often does that happen? It's rare, but can it happen? Absolutely it can. And generally what we're doing is when we make that incision, the incision actually goes back into the hairline, and then we're advancing this whole part of your scalp. To give that a little bit more stretch and to advance it a little bit more, what we do is make incisions underneath the scalp flap. And that can sometimes compromise the blood flow. So if you have a surgeon that's really aggressive with galeotomies or making those incisions, that can sometimes result in shock loss. Or if you're putting a lot of tension on the scalp and really trying to pull the scalp down, that can cause shock loss. What happens after shock loss? In general, they will come back to some degree. The hairs will grow back, but they may not grow back 100%. So you may have some permanent hair loss there. Now that is a rare complication. In general, if you do have a little bit of hair loss, that tends to be temporary and that grows back as the blood flow is restored to the scalp as it's healing. So what do you do to avoid complications like shock loss and hair loss? Basically not pulling too hard on the scalp. And so that begs the question, well, how much can you go down? Well, there's two different ways to do a forehead reduction. One way is to do a one-stage procedure where we simply make the incision, advance as much as we can. If we do that, generally we're going to get about 2 centimeters. So if you measure on yourself, you can take a ruler and simply measure your hairline and see where 2 centimeters would be further down. 2 centimeters would be a reasonable expectation. Sometimes you can even get up to 3 centimeters. In a two-stage procedure, that's when you're talking about anything greater than 3 centimeters. So for a two-stage forehead reduction, the first stage would involve placing a scalp expander or a tissue expander underneath the skin, and that tissue expander would then be inflated to stretch out the skin of the scalp. At a later date, that's taken out, and then you follow it the second stage with the forehead reduction. That allows us to get even more than 3 centimeters. That does mean, in the meantime, while you have the tissue expander in your scalp, that it looks pretty large and bulky, so most likely you will have to cover that up somehow with a hat or something stylish, but if you don't have anything on there, it is going to be fairly visible and will look abnormal. After that procedure, this tissue expander is taken out, the forehead's brought down, and we can really get a nice result. I would say most people opt for a one-stage procedure, and by and large, that's going to be a huge improvement for people. So if you have questions about a forehead reduction or you've never heard about it before and this just blew your mind, feel free to leave a comment. I'd love to hear from you. And thank you very much for checking out this video. I will see you on the next one.